When you think about being healthy today in this world just full of information, what really comes to mind? Is it like just not feeling sick? Or is there something deeper going on? Welcome to the deep dive. Today we're really getting into the fascinating world of health and wellness. We've gone through quite a bit of material here: definitions, what shapes our health, common diseases, lifestyle stuff, and importantly, navigating health information. Basically, our mission is to cut through all that noise and give you a solid shortcut to understanding this really crucial area.
Okay, so let's unpack this right away. We often toss around healthy and wellness.
Hmm.
Are they actually different? I mean, what's the real distinction between just being healthy and, pursuing wellness?
That's a really good starting point. Because they are related, definitely, but they're not quite the same. Health, fundamentally, is defined as, well, it's a state of complete physical, mental, and social well-being. And crucially, not just the absence of disease, it's dynamic too, always shifting a bit.
Okay, so health is the state. Exactly. Now, wellness, that shifts the focus. It's an active process. It's about making conscious choices day in, day out towards a healthy and fulfilling life. So you could say health is kind of the state you're aiming for or find yourself in, and wellness is the active journey to optimize it.
Ah, I see it. The journey versus the state. That makes a lot more sense. So wellness isn't just one thing then. It's got multiple parts, these dimensions you mentioned.
Precisely. It's multifaceted. The research we looked at really breaks it down into 6 core dimensions. Sometimes you see 7, but these 6 cover the essentials. First up, physical wellness. This is the one most people think of first.
Right, diet and exercise.
Yeah, exactly. Maintaining your body through good nutrition, regular exercise. The sources suggest around 40 minutes for adults most days is a good target. Getting enough sleep, avoiding things like smoking, obviously, and keeping up with medical checkups. It's really the foundation. Then there's emotional wellness. This is all about your ability to understand your emotions, manage them effectively, and express them appropriately. It also includes coping with stress, building resilience. Really important stuff.
Definitely, and linked to that.
Closely linked is mental, or sometimes called intellectual wellness. This involves being open to new ideas, thinking critically, solving problems, continuing to learn through life, and fostering creativity, keeping the mind sharp and engaged.
Okay, so physical, emotional, mental. What else?
When we move into social wellness, this is about building and maintaining healthy relationships, having strong social networks, friends, family, community, and contributing to that community, that sense of connection and belonging.
Makes sense.
Next is environmental wellness. This one's maybe less obvious sometimes, but it's about understanding how our surroundings, the natural environment, our built environment, deeply impact our health. So protecting resources like air and water, dealing with pollution, climate change, it all plays a role. Our health is tied to the planet's health.
That's a really important connection to make.
Absolutely. And finally, occupational wellness. This isn't just about having a job, but finding satisfaction and sort of enrichment in your work.
Yeah.
And crucially, finding a healthy balance between your work responsibilities and your personal life. The whole picture of how your career affects you.
Wow, okay. So putting it all together, it really highlights how you can't just focus on one area, can you? Like, you could be physically fit, but if your social or emotional wellness is suffering.
Exactly. They're all interconnected. It's a web. True well-being means tending to all these dimensions. It's so much more than just, going to the gym or eating salads.
Okay, so we've got a handle on the definitions. Now, moving beyond that, what are the big picture factors, the things that really shape someone's health? Because it feels like it's more than just individual choices sometimes.
You're absolutely right. That brings us to what the research calls health determinants. These are basically all the different factors that influence your personal health. And yeah, it's a complex interplay, very dynamic. The sources break them down into 4 main categories.
Well, our categories. Okay, what are they?
First, there are social and environmental determinants. Think about the conditions where you live, work, and play. Community factors, social interactions, the quality of your housing, access to clean air and water, pollution levels, all that background stuff.
Right, context matters.
Hugely. Then second, biological and genetic determinants. This is stuff like inherited predispositions to certain conditions. Age is a big factor too. The materials note that health often changes significantly after 40, for instance. And gender plays a role in susceptibility to certain things as well.
Okay, so things you're born with or that change as you age.
Correct. Third, and this is the one people often focus on, is individual behavior determinants. These are the personal choices we make: nutrition, physical activity, sleep habits, whether we smoke, substance use, things like that.
The lifestyle choices.
Precisely. And the fourth category is health services. This covers the availability, accessibility, and quality of healthcare. So hospitals, clinics, diagnostic services, preventative programs, can you actually get good care when you need it?
That's really interesting seeing it broken down like that. And you mentioned these connect to broader goals.
Yes, exactly. And this is where it gets really concrete. These determinants directly inform national health strategies. For example, Saudi Vision 2030 explicitly aims to improve community health, tackle chronic diseases, and increase life expectancy, addressing many of these determinants. What's really striking is the timeline mentioned 2016 to 2060. That shows a really long-term strategic commitment.
A multi-decade plan. That's serious investment. Okay, so with those determinants in mind, how does this actually play out? Let's look at the health landscape itself, the common challenges.
Right, so our overall health status as a population or individually is shaped by the prevalence of various diseases, injuries, and of course those lifestyle choices we mentioned. And there's actually a positive background trend globally. Life expectancy generally went up between 1960 and 2020, which is good news, suggesting improvements overall.
Good to hear. Now let's talk diseases, non-infectious diseases, NCDs. We hear that term a lot. What exactly are they and why are they such a big focus?
Okay, so NCDs, or non-communicable diseases, are conditions that aren't caused by an infectious agent. They're typically influenced by a combination of genetics, environment, and importantly, those behavioral factors. They tend to be chronic, long-duration conditions.
And the key examples?
The data highlights several major ones. Diabetes, for example, which affects how your body processes blood sugar. The prevalence figures are quite telling. Overall, about 8.5% for people aged 15 and up. But look at the 65-plus age group, it jumps to almost 50%, 49.2% specifically. That's a huge increase with age. Slightly higher in females than males overall, too.
Wow, nearly half of older adults. That's significant.
It really is. Then there's cancer, characterized by that abnormal cell growth. Common types mentioned include breast and colon cancer. Overall prevalence cited is lower, around 0.18% for those 15-plus or, but the impact in terms of mortality is stark. The figures mentioned show significantly more deaths among females than males in KSA for the period studied.
So prevalence isn't the whole story there.
Not at all. Then cardiovascular disease, heart attacks, strokes, conditions affecting the heart and blood vessels. It's a massive killer globally. The prevalence in KSA was cited around 1.21%, and again, it becomes much more common after age 50.
Another one that increases with age.
Definitely. And lastly, hypertension or high blood pressure, a very common chronic condition. Affects about 7.6% of those 15 and up, slightly higher in males. And just like diabetes, it skyrockets in the older population, also reaching that 49.2% mark for the 65-plus group. These NCDs are clearly major challenges, particularly as populations age.
Okay, that covers the chronic, non-infectious side. What about the other type infectious diseases?
Right, the communicable ones. These are caused by pathogens, bacteria, viruses, fungi, parasites. The source material gives a few examples relevant to the region. Hepatitis B, a viral infection attacking the liver. Spread through blood, bodily fluids, unsafe sex, shared needles, even mother to child. Good news is, there's a vaccine.
That's important.
Very. Then Malta fever, also known as brucellosis, this is bacterial, often from contaminated animal products, unpasteurized milk or cheese are common culprits, or direct contact with infected animals.
Okay.
There's also dengue fever, a viral disease spread by the Aedes mosquito, causing high fever and flu-like symptoms. And salmonella infection, common bacterial foodborne illness, think food poisoning causing fever, diarrhea, cramps.
So how do these compare in terms of numbers?
Well, looking at the specific data provided for reported cases, hepatitis B actually had the highest number, followed by dengue fever, and then brucellosis was quite close behind. So while NCDs might dominate mortality stats, these infectious diseases represent significant ongoing public health issues too.
Got it. So if we zoom back out and look at the overall causes of death from the data, what's the big picture?
The big picture is pretty clear. Heart disease alone accounts for a huge chunk, 37%. Then other NCDs make up another 20%. So together, that's well over half, nearly 60% of deaths attributed to non-communicable diseases.
Wow.
Yeah. After that comes injuries at 16%, and then infectious diseases at 11%. This breakdown really drives home why the focus is shifting toward prevention and managing NCDs, like in the Vision 2030 health plan. You have to tackle the biggest threats.
That makes perfect sense. The data really points the way. So given this landscape, the determinants, the major diseases, what can we actually do? How much control do we have through our lifestyle?
A lot, actually. This is where the concept of a healthy lifestyle comes in, and it's incredibly empowering. It's defined as that balanced mix of physical, mental, emotional, and social practices. The main goal: improve health, prevent disease. And get this, the sources suggest that adopting key healthy lifestyle habits can potentially cut the risk of NCDs by up to 80%.
80%, that's massive.
Yeah. It's huge. It really underscores the power of individual choices.
Yeah.
So let's break down those key factors the research highlights.
Please do.
Okay, first, metabolism and physical activity. Regular exercise, balanced diet, it's fundamental for energy, body function, overall well-being, not just about weight. Second, healthy nutrition. Avoiding excessive fats, sugars, aiming for balance to prevent obesity, diabetes, heart disease. Pretty straightforward, but crucial.
Right.
Third, sleep and rest. Cannot emphasize this enough. It's vital. The recommendations vary by age. Adults generally need 7-8 hours. Kids and teens need significantly more, like 8-10 for adolescents, 9-11 for younger kids, even 10-13 for toddlers. It's foundational for repair and function.
Sleep is definitely underrated sometimes.
Totally. Fourth is mental health and stress management. Actively managing psychological pressures, using positive thinking, relaxation techniques, mindfulness, and importantly, recognizing when you might need professional help and seeking it out.
Taking care of the mind as well as the body.
Exactly. Fifth, personal hygiene. Basic stuff. Really keeping yourself and your environment clean to prevent infections. Simple, but effective. And sixth, quitting smoking. The research is unequivocal. It's one of the single most impactful changes you can make for your health, with benefits starting almost immediately.
It's really powerful seeing it laid out like that. These aren't, impossible goals. They're concrete actions with a massive potential payoff in reducing risk for those major chronic diseases. It feels like a practical guide.
Okay, one last crucial area. We live in an age just overflowing with information, especially health information. It's everywhere. How on earth do we sort the good from the bad, the reliable from the just plain wrong? It feels overwhelming.
It absolutely is a major challenge today, and getting it wrong can have serious consequences. So health information resources, basically any source of health data, digital or not, need careful navigation.
What kinds of resources are we talking about? Well, there are the electronic health information resources. Think websites, especially looking for reliable domains like .gov, .edu, mobile health apps, online forums. Lots of digital options.
And social media, everyone seems to get health advice there now.
Right. That's a big one. Social media and health information. The stats show incredibly high usage, like over 90% of the Saudi population use social media in 2021. And this is a huge but, it's absolutely riddled with unreliable info and misinformation. You have to be so careful there. It's often opinion presented as fact.
A real minefield, as you said earlier.
Definitely. Then you have personal and public sources. Your doctor, other healthcare professionals, ideally your most trusted source. Also family, friends, though their advice needs checking. And traditional media, TV, radio, newspapers. And importantly, local and international health organizations. Groups like the World Health Organization, WHO, nationally the Saudi Ministry of Health, their website, mana.gov.sa, was cited as a key resource, and the Saudi Health Council. These are generally your gold standard sources.
Okay, so lots of different places information comes from. But the crucial question, how do we judge it? How do we know if what we're reading or hearing is actually trustworthy?
Excellent question. The materials lay out some key evaluation criteria. Think of it like a checklist. First, accuracy. Is this information factually correct? Can you verify it elsewhere? Second, objectivity. Is it balanced or is it biased? Is someone trying to sell you something? Third, timeliness. Is it current? Health information changes rapidly. Old advice might be outdated or even harmful.
Okay, accuracy, objectivity, timeliness.
Fourth, relevance. Does this actually apply to your specific situation or health need? Fifth, and this is critical, source reliability. Who's behind this information? Are they experts? Is it a reputable organization? What are their credentials? Sixth, clear language. Is it easy to understand? Or is it full of jargon designed to confuse or impress? And finally, privacy. Especially online, does the source respect your personal data?
That's a fantastic checklist. Accuracy, objectivity, timeliness, relevance, source reliability, clear language, privacy.
Exactly. Running information through those filters can help you weed out a lot of the noise.
This is so incredibly important. The takeaway seems crystal clear. Be skeptical. Be discerning. Always, always prioritize information from official health bodies, government sources, and recognized medical institutions over, some random blog or a viral social media post. Your health literally depends on getting accurate information. Wow, we've really covered a lot of ground in this deep dive on health and wellness. We started by kind of teasing apart the difference between just being healthy and actively pursuing wellness,
Mhm.
looking at all those different dimensions: physical, mental, emotional, social, environmental, occupational.
That interconnectedness.
Exactly. Then we dug into the health determinants, those big factors like environment, biology, behavior, and healthcare access that shape our health outcomes. We looked at the landscape of diseases, distinguishing between those major NCDs like diabetes and heart disease and infectious diseases, and saw how NCDs are the biggest mortality
Right,
drivers.
which explains the focus on prevention.
Precisely. And that led us to the power of a healthy lifestyle: nutrition, exercise, sleep, stress management, hygiene, not smoking, and that incredible potential to reduce NCD risk by up to 80%. And finally, we tackled the crucial skill of navigating the complex world of health information, learning how to evaluate sources critically.
It really highlights that health isn't static, is it? It's an ongoing process. Wellness is a journey that requires informed choices, adaptability, and looking at the whole picture, not just isolated parts.
Absolutely. So maybe the final thought for everyone listening is this. Now that you have this deeper understanding of your own choices, the wider influences, and how to find reliable information, how can you use it? How can you become a better advocate for your own health? Or maybe even start conversations about health and wellness in your own family or community? Something to definitely think about. Thank you so much for joining us on this deep dive. We hope it's given you some valuable insights for your own wellness journey.